Dr. G.VIJAYAKUMAR, working as Professor and Head, Department of Clinics, Madras Veterinary College, Chennai. He finished his BVSc degree program during 1994, MVSc at 1996, and Doctor of Philosophy in Veterinary Medicine at 2001 from Madras Veterinary College. He got 25 years of experience in teaching, research, and extension in veterinary medicine. He has published more than 109 research works in national and international journals. He also published 36 popular articles and 5 books. He guided 6 MVSc scholars, 3 doctoral scholars in veterinary medicine, and 3 postgraduate diploma scholars in veterinary endoscopy. He acted as principal investigator for various state and national funded research projects. He acted as principal investigator for various He got 19 awards for his outstanding achievements in veterinary medicine. He standardized many innovative clinical procedures in veterinary medicine, which includes 6 minutes walk test as stress test for diagnosis of cardiac diseases in dogs, cardiac catheterization in dogs, and nasoendoscopic imaging of rumen and reticulum in cattle. He also established critical care and imaging units in college and offers training to the students and practitioners. His fields of interests are internal medicine, ultrasonography, critical care, cardiology, and endoscopic imaging. We request you, sir, to take the dais.
We should appreciate and congratulate ourselves for the steps taken to attend continuing veterinary education. Because as a veterinarian, we need to increase or improve our knowledge and skill day by day to serve the farmers as well as the animals, thereby improving our country. So I really congratulate and appreciate everyone. At the outset, I thank the Lama Tamil Nadu for having given the opportunity to interact with the our own colleagues. The topic is clinical procedures in biotic practice, and many of these procedures are already being done or being carried out by every veterinarian in the field. Here and there some tips which I may take from you, or sometimes it may be a totally old one. So just what is there in deep Salkayan Gairi, I am bringing to the fingertips. So there may be some mistakes being pronounced out of me that you have every right to correct me. This I like it. James Herriot is also it. If you decide to become a veterinary surgeon, you may not grow very rich, but you will have a life of endless interest and variety. So because every case, every dystocia, every prolapse is a new case, and we enjoy it. Unlike that of a cardiovascular surgeon, which he does only cardiovascular surgery repeatedly and becomes an expert, but he doesn't have a variety. We have a variety in insemination, in repeater, dystocia, and then downer. Every case is a variety. So we enjoy that. And every farmer, he has got his own lifestyle and stories and background. So we enjoy every case. So that is what I agree with James Herriot. Many of our colleagues also will accept that. So this is a case which many of us day-to-day life, we encounter this case. A part of it which we are supposed to do it, which can prolong the life, especially in case of full-term animal, especially to have a live calf. Otherwise, most of the cases are being condemned, or because in the virtue of the hands of experienced vets, these are being saved. So what is the procedure? This is pericarditis, which everyone know. Jowl edema, brisket edema, and then muffled heart sound. What is the procedure? We will see it shortly. The most important part is the physical methods have been taught by our teachers. Many of us are practicing. Now gadgets are also available to re-emphasize our diagnosis at bedside to the animal, and we have a chance to explain to the owner also. This is the condition, and we are going to put a catheter or the procedure to save the animal or otherwise. So for those who are not touched, so this will be repetition. The bigger one is the left ventricle and smaller one is the right ventricle, because that supplies a major one. Now this is of a normal, healthy cattle which you are seeing. Now we will see the ultrasound of a disease animal in the next slide. So this is a pericarditis affected animal. You can see the white arrow where there is a fluid accumulation, and depends upon the stage, whether it is an early stage or a well-established stage, that will dictate whether it is a black color. Anything which is black is fluid, so like watery. So each with the proteins or with the pus, it will be going for echogenicity. We call it as echogenic or increased fibrin strength. We will appreciate in the next slide. So this is a full play case where this is the heart, and this is the fluid accumulation. And well established case where you get a fibrin deposit. So as you know, what is the pathophysiology in pericarditis is restrictive pericarditis. It is not able to pump. So this restriction caused by the fluid or the fibrin has to be removed for the heart to function normally, so as to establish effective circulating volume. That is what we are going to do. So we are going to remove the fluid either by means of putting a catheter or temporarily by putting a needle. So what is the procedure? Procedure is paracentesis. This is a full-fledged case. There is no meaning in doing it. Otherwise, a procedure where it is a partial pericardectomy. Maybe Sir will explain if it is apt with the surgery procedure which is supposed to explain. The full-fledged case you can explain. So the bedside diagnostic, one of the tool or boom is ultrasound, where you can tell the prognosis and explain that also. And moreover, it is mobile, ambulatory, so you can take to that. And of the various gadgets available, ultrasound is a boon because you can carry it to the doorstep and do it. So this helps us to whether we are going for a catheter placement or only a needle placement, or we are not going to treat the case. So that also, in addition to diagnosis, ultrasound helps us to pronounce the prognosis. So because when you put the catheter and after that the animal is not improving, then it is questionable. So it gives us a chance to pronounce the prognosis also. Starting stage, what we have done, based upon auscultation, our teacher taught, we have put a centesis. This is a centesis, pericardiocentesis, putting a needle and then collecting the fluid. The fluid also gives us a knowledge, whether it's a clear or serous, serous sanguineous, purulent. So that also helps us to stage the pericarditis. Accordingly, we can tell the prognosis. So the site is the fourth or fifth intercostal space. Whether I will do it on left side or right side, whichever side is convenient to you, you can do it. But the thing is, the forelimb, that is the front limb, which side? The right side you are going to put, this leg has to be secured properly. Okay. If you are doing it on left side, pull it in a forward stance and secure it. Otherwise, because you are going to do it here only, behind the elbow, so animal will keep on moving, you may not be able to do it. There will be 2 or 3 punctures. So secure the leg in which side you are going to put, and then you do it. It becomes a very simple procedure, and do it. So for the fifth intercostal space, the choice is yours. You can use a supracap or chest drainage tube. Now this is a chest drainage tube which you have been using in the initial stages. It also works very good, but you have to put a purse string suture and then Chinese finger knot. So many things has to be done. And as you see this slide, this is a purulent. Now you can see this is a serous sanguineous. When compared to the first one, second and third, this is the worst case. So we have got a chance just by a centesis with a needle. 16 gauge needle is available throughout India. Putting a needle, you cannot kill the dog or the animal. So put the needle for the benefit of the diagnosis. You can identify, stage the prognosis, and then you can do it. Suppose if it is clear and the animal is full-term pregnant, maybe 10 or 15 days. Now you can save the animal by putting a catheter. You can place the catheter, do lavage, and then do it. We will see in the subsequent slides. So this is a chest drainage tube. Now this is a supracath. Supracath has a beautiful advantage. So it has got a Foley's bulb, just like a Foley's catheter. And in addition, it has got a trocar also. So it is commonly used in human. The cost is only 160 rupees. 160 rupees is nothing when you are going to compare the treatment. So you can put a lignocaine and then put a nick, introduce the needle, then it goes inside, and then you inflate the Foley's. It will be there. Then you can flush it. So that advantage is there with the supracath. You can see the free flow of fluid. After drainage, you can flush with the normal saline. If you think, you can also flush it with metronidazole and then do it. So this is how we flush it with normal saline and metronidazole. and it has got a fixator also, you can fix it. Stage switcher, and all this is available instead of a chest drainage tube. That is also costing 200 rupees, but you have to put a extra switcher, purse string, and Chinese finger knot. This is very simple, put only 2 stage switches there. This is one such case. This is another case which was pregnant 10 or 15 days before calving. The animal was put a catheter and then drained. It has calved. After calving, it is discharged. So this, I am not telling this pericardial centesis is a treatment. Subtotal pericardiectomy is the actual treatment where you have to remove it. But that is not possible in the field. This does very good. Recurrence is there. Don't tell it's a foolproof treatment. It's not foolproof, recurrence will be there. But you can save a valuable dam, at least to have its offspring. So that way it is useful. A simple procedure, put a needle and diagnose the case. And similarly, when you diagnose in the thorax, that also can be done. And these are the things, the salient feature is non-clotting, and the bacteria, it is not with bacteria. So this will be in the 7th intercostal space. Only the site differs. So you can use a peritoneal catheter or chest drainage tube or supracath. So like this clear fluid or straw colored fluid. So these have got an advantage that we can put a catheter and then prolong the life. So complications, it's very rare. Sometimes it can go for a collapse of the animal because of accidental puncture. Abdominal centesis. This is again one of the important techniques. All centesis are a boon for the veterinarian to identify the disease on this part. So you have to put the needle. Only thing is you should have intention to put the needle. You put the needle, nothing will happen to the animal. So the differential diagnosis is this one: ascites, peritonitis, uroperitoneum or neoplasia. Just put the needle, you get the smell of the urine. You can tell this is a uroperitoneum. What is the site? 8 to 10 centimeter caudal from xiphoid and 8 centimeter lateral from the midline. So this is how you identify whether it's a clear, cloudy, it indicates the more amount of protein, and then serosanguinous, as we have seen in the catheter draining of the fluid, and more turbid, it is a perforated abdomen. But the intention is you put the needle and then you can see. Put the needle and you can feel the needle entering it, and you'll get a sound that only the experienced person can feel the pop sound. Okay, you'll get free flow of fluid. Maybe if you are a beginner, you will be puncturing the rumen accidentally. Don't worry, and then keep on repeatedly doing it, you become a perfect. So this has been explained in the students because it was already 5:30. So we put a needle 8 centimeters from xiphoid and then 5 centimeters approximately. If it is an adult hand, so you can take 7 fingers, okay, or 1 hand. If it is an adult, maybe mine is a little bit smaller, maybe a big VAS, 1 palm. Okay, begin the xiphoid, and similarly 1.23 fingers, you put a needle. After explanation, it was almost 5:30. I said we will continue the class next day. Next day case has come, and the student yesterday Sarah started pericarditis, peritoneal centesis. Let us put. He has put the needle. Immediately fluid has come. I told you invariably you will be puncturing the rumen. You need an experience. 1 or 2 times you have to do, and then keep on practicing. Then he got the fluid. Then he got his girlfriend. He put the needle. She also got. Then she got her foot. Say, all 4, 5, 6, all are getting in single stroke. This man told we need experience. Putting a needle, immediately I got. So what is the speciality in this? Because it was already 5:30, we left. Then again he called, sir, you told about getting a fluid from the peritoneum, peritoneal centesis. So please demonstrate this. Then I asked, what is the case? He said, all 5 are got in a single stroke. Then we have encouraged. So the only take-home lesson is, the animal should not be pregnant. Right? Because it was 5:30, because of lack of time, I didn't tell. What is the prerequisite for this one? Animal should not be pregnant, because you are putting, it is a fetal fluid. So all will get. So when it is pregnant, you may not be having a doubt on peritonitis, isn't it? So that is a difference. So differentials should always be in mind when you go for a particular procedures. So exceptions and the precautions told in the class or by our teacher should always be in our Salkayan guide. That is only take home lesson. So this is the other side. What we have been describing is a cranial side. Now we have got a caudal side. Caudal side is on the right side. Okay, it is on right side. I am standing on right side. You have got a flap of fold of the skin. Okay, somebody has to pull the flap of the skin. So you will see the spot of the udder. Udder will be seen. Then in front of the udder you have to put the needle. Now in the video I have not put the someone holding the flap of skin because it will mask. So there is a free fold of skin. This skin, fold of skin, you hold it and lift. Okay, then you will see the udder. In front you have to put the needle. That is the side, caudal side. So if you have a fluid in both the side, then it may be a diffuse peritonitis. It may be in one side, caudal or cranial, it is a localized peritonitis. You have a chance that you can go for a treatment. Immobilization, tie the animal in 2 or 3 days, put on a broad spectrum antibiotic based upon experience. There is a likelihood it can become all right. So diffuse, then you go for what are the probable cause for diffuse peritonitis. Don't forget to rule out ascites. It can also because of hypoproteinemia. Hypoproteinemia can also because of worm infestation. These are all prerequisites. So if it is a diffuse, then it can be because of ascites, hypoproteinemia, because of worm infestation also. So don't forget to rule out. Then in these cases, if you think your area or your belt is more of a foreign body, you can also use magnet. Magnets roughly cost about 650 rupees if you are going to get it in bulk. And this is a magnet administrator gun. So put it, just open the mouth and it will go inside. And it takes some days to settle in the reticulum. This will prevent the foreign body. If you think your area is having more amount of foreign body, this is a good one. Or if you have a farm, you can advise them. So radiograph is depicting the presence of the reticular magnet. This is again another important technique is a ping sound, where how do you elucidate? It is by simultaneous percussion and auscultation. So auscultate and do by flip of a finger, you will get a sound. That sound they describe so many ways by putting a coin in a silver or a copper vessel. But you should hear to that once, then you will not forget lifetime. Or put a pebble in a well, that is a sound. But whatever sound is described, you have to hear it once, then you will not forget. But this is how they describe. So why this is used? This is ping sound. You will get any organ which has got, it should have a fluid as well as under pressure. Any organ should also have a pressure as well as fluid. Then you will get. So our thing, best one is the LDA, recently carved animal, and not taking feed, maybe scanty diet. Then you can do from the paralumbar fossa to the elbow, you do the percussion and auscultation. So if you get the ping sound, then keep on marking where all you get. Then you will get the salute or the outline where you are getting the ping sound. Then you can go for lip tag test. Are you able to understand? From the elbow to the paralumbar fossa, you have to keep on doing the elucidation of ping sound. That is combined auscultation and percussion. So as you get, you keep on marking. If here you don't get, so here you get, keep on marking and then join the outline. Then that is the part, and dependent part you have to do it. So you mark the outline of the area where you get ping sound. In the dependent area, you put a needle and collect the fluid. Check for the pH. Naturally, you have to get alkaline. If it is rumen, it is not alkaline. It is acidic, so it is a abomasum. So this is the early stages which our teachers start ping sound. Then what we have done, putting a needle, getting the fluid on the organ under doubt. That is called lip tag test. You put a needle, collect the fluid, check for its physicochemical properties and micromolecules. Here you are going to check the pH and check for its presence of protozoa. Presence of protozoa means rumen, and alkaline means rumen. Acidic pH is abomasum. So this is a lip tag test. So you put it as the dependent part. Now our trendy part is your ultrasound. In case of ultrasound, you never get like this in the left paralumbar fossa. You will get a fluid, and more important part, you will get a abomasal folds. We will appreciate in the video. So abomasal leaves, you would have seen numerous abomasal leaves just like a shelf. That will be seen as a hyperechoic because it's not a fluid. You will get a hyperechoic shelves. In the subsequent slide, you will see more number of cells. So that you will get abomasal leaves. So Betty diagnosis, then you can do the part. Same thing you will get in an RDA, right side displacement of upper muscle. Animal is right side, and these are the upper muscle leaves, and this is the fluid. Here you see number of upper muscle leaves. A SPAR diagnosis, just reinforcing your physical methods of examination taught by your teachers, lip tag test, and your ultrasound. Now this is another case where those who are having many number of DH in their field, they can try this. This is a thoracoreticulocentesis. Diagnose DH. What is that? You should select on right side of the thorax. Again, the right side of the thorax, you should auscultate. The prerequisite, you should auscultate. You will get heart sound. That area you can leave it. You should select an area where you get some sort of sound other than the heart sound, some mixing sound or peristaltic sound. That area you choose, disinfect or put a spirit, and then you can use a 16 or 18 gauge needle. You have to do lip tag test, aspirate the fluid and then see for the material. So that is called thoracoreticulocentesis. You have no business for the rumor to come into the thorax. Then if there is a protozoa and alkaline pH in the thorax, then it is a DH. This is thoracoreticulocentesis. Nowadays these are very common. Again, some amount of common sense of this has to be inculcated to protect the society and to provide green earth to our future generation. So this has to be inculcated. Previously in the syllabus this was not there, thinking that we are all following that. Now it becomes a syllabus, then we have to have a rally and we have to implement law also. Now this all has been come in biomedical waste management. You have running a veterinary dispensary, now you know it becomes a mandate that every dispensary has to be registered through biomedical waste management. So this is one such to have the awareness. So this is a fishing net which is left, and you know our cattle or grazers, so they got tagged. So you, those who are seeing small animal practice, you know these lenient foreign body are very common in dogs, more so in case of cat. What is linear foreign body? It's not linear, it is a thready mesh like this, or a nylon rope or fishing which gets entangled in one part. Maybe the tongue or the epiglottis, the other part goes down the esophagus into the stomach, or one part in the stomach goes down to the intestine. Then as the peristalsis starts, then cuts the intestine just like a axa. Then it goes for peritonitis. And it goes for intercession also. It is very worse in case of cat or dogs. But here it is getting in the tongue. So same also in case of cat. So you just see as a part of it, anything animal not anorectic, oral examination, how it is important, rectal examination is important, it's as a must. You open the mouth and explore the things. This is a fishing. Now after this damage, and here it was down into the esophagus, we explored through endoscope and appreciated it. Now these are 2 or 3 cases which I clubbed together so that you can also think what it could be a probable cause. This is a case number 1A, and is not taking feed, and he is advised by a field doctor or a practicing veterinarian to give aloe vera, suspected that it may be a thyleria, upper basal ulcer, give aloe vera. Then aloe vera is given by the owner. Then from that, after giving aloe vera, there is a salivation and not taking a feed. That is one case. To make it more interesting again. So then case 1B, another one is reduced feed intake, salivation after passing the stomach tube. Okay, so he has treated for stomach tube, probably he has given a cut transplantation. So but after that, it is not taking feed. Then case 1C, this is also many, we are not supposed to discuss about, some drenching tube for post carving to promote, to prevent ketosis or increase the calcium, some sort of things, these are given. Again, this animal is not taking feed. So what is the take home lessons or importance? Many of us, we do not have time because cases are waiting for us to attend, and the communication gap, what we thought should be properly communicated to the owner to avoid these cases. So for this, if I show the endoscopic pictures, so you will also appreciate what are the lesions. 20 years back, I was telling like endoscope, which I am going to explain. I was explaining and shouting like anything about ultrasound. And no one was listening. The ultrasound is such a big gadget, so this we cannot buy and it is not practically possible in field condition. Now you see the scenario is, ultrasound is one of the boon for a vet to spot diagnosis. Same way the endoscope is also picking up in many places. I expect the endoscope also will definitely pick up because it gives more realistic values for certain cases which we are going to discuss. So simple it is, the advantage is no anesthesia, the nasal route is possible, so you can put a sedation if it is a uncooperative buffaloes. Small ruminant, again nasal route. Okay, so simply putting on that and put a nasal route. So the endoscope advantage is anyone can do it. So procedure is take care of the equipment. Otherwise, the interpretation very easy. It is very easy, it directly gives what is abnormal. So this one is, as you enter in the nasal cavity, this is, you remember, a pinkish mucosa. And next, you know, this is arytenoid cartilage and that is epiglottis. This we have already seen, but I am recapping it so that you will appreciate the lesion which we are going to discuss. Arytenoid cartilage, then you pass through that, you will go to the trachea. Okay, for your information, the trachea is, this is a C-shape, and in case of coughs, it is a teardrop shape. That is a speciality. And this is apical bronchus to identify this is a cattle. And this is the esophagus. Esophagus will have linear folds. I am telling about a normal animal. Lower esophageal sphincter, and we are going to enter into the rumen. And this is the reticulum, and going deep into that, we will get rumen. This is normal. Now, as far as the calves or sheep and goat, we can put oral also, and nasal cavity also. So now coming on to the 1A, B, C cases. Now this is what we have given. So if you have given, ask him if he is experienced person to give it. Since we have, there is a communication map, give this tube and ask to give it. So what happened is, this has caused a tear, pharyngeal tear. He has introduced because the animal was not cooperative or the person is inexperienced. And your advantage, your thinking is to prevent ketosis. Already you have given isoflurane or D20, and then to further manage you have given, or to prevent calcium, you have given calcium. But ultimately it has caused a lesion that has extended the period of anorexia. So if he experience, if he is not able to give, you give it, or educate the person about these aspects. See how much damage is there. And this is part of what happened is our person has advised to give aloe vera. Okay, so what happened, the father-in-law has given aloe vera, and then he had a doubt whether it has reached his stomach because he doesn't know whether. So he took a stick like this and they introduced it. And then there was a quarrel between father-in-law and son. Son-in-law came, you old man, you cannot do it. He took it and they inserted. The entire stick went inside. He is confirmed this has gone into stomach, bracket rumen. And from that day onwards, the animal is anorectic. Okay, so this is how it has come. Then when he encouraged aloe vera by good intention given by a practitioner, then ultimately this part is missing. So what happened? We have put a gag and entered. This is gone through and through. This is the epiglottis through and through, esophagus, and it is lodging there. So you properly communicate how to give the medicines. We spend 2 more minutes and then get back from his mouth. So communication gap, aloe vera, to check the aloe vera is inserted, and this is a permanent damage. I don't think the surgery will do it better. So much damage near, especially near the epiglottis, it has part in the esophagus. And this is the putting on stomach tube. Nowadays everyone starts to put a stomach tube, whatever gadget is available in the garden also, hose pipe, garden. So proper care has to be taken. The proper thing is the rumen intubation tube, or you can, if you are going to design or modify, see that the esophagus or the pharyngeal mucosa is not damaged. This is normal. See, this is because esophagitis. This will also account for anorexia, not taking feed or especially fodder for 2 or 3 days. So our intention is to check the rumen fluid as well as to relieve acidosis or to give transplant. But don't use all the gadgets which you think is the best. Adopted by, I have used in 20 animals, 200 animals, nothing has happened. But something has happened. So please take care that also, which can account for half a day or 1 day anorexia. So proper care, either in trimming the gadgets which you have taken, maybe a hose pipe, or at least put a micropore tape, or something like that. So to tell that this also causes esophagus, a potential cause for anorexia. And this is the lesions, laceration, severe case. And this one, all your movement should be done like this only. You know, experienced passing of the stomach tube is only by lateral movements, fingers or wrist movement. A person heroically putting it, and then the animal came with the probank. So this type of things, gentle, how you approach, how you speak, how the gentle with the animal also. That is the carry home lessons. Then that is to educate the request is to educate the owner how to give. And this is also case regurgitation for 4 days, whatever the fluid it comes out. And the advantage is the radiograph. This is a barium meal staying there. Diagnosis is megaesophagus. And then the gadget which I have explained is the endoscope. So endoscope, this is a normal which will have a linear folds. Okay, here you can see Ajanta Ellora caves. Diagnosis is very simple as far as endoscope is concerned. Ultrasound, interpretation is difficult. Doing is easy. So it will be always the reverse. When the procedure is tough, interpretation is easy. When the procedure is easy, interpretation. So this is Ajanta Ellora cave. Anyone seeing it, they can understand this is a megaesophagus. You can explain the owner. Now this is a video explaining how the esophagus is so much dilated. Okay, so that case, certain cases of congenital megaesophagus also come. You get acquired megaesophagus also. So we have experienced many cases in subsequent to botulism. If it is botulism, a dormant case which do not exhibit full-fledged paddling, recommend dies. So that is the full-fledged case, which is a mild case which will not exhibit standing but anorectic. So those will have a megaesophagus. So that maybe you put on a fluids for a considerable period of time, maybe 7 days, this becomes all right, as long as that effect of the toxin has gone. This is a beautiful term, tyloria. Tylism is salivation. Sialoria is also tylation. The person, they have put both the words, tylism and sialoria together as tyloria. So what does it mean? Salivation, excess production is this one. It is not because of excessive production, normal salivation which has got accumulated and then brought back. That you will understand by seeing this. Right. So this is because maybe a megaesophagus or esophageal problem subsequent to a choke. Normally our kids vomit like this, we rarely see this. So use of requesting to use proper gags. Many are using gags, but take care of the safety of veterinarian. You are a precious veterinarian in the field, so you should protect yourself also by using a proper gag. Proper gag is not that much when compared to your life. The number of large animal veterinarians are decreasing day by day. Everyone has got a fancy of moving into the small animals. So we need large animal veterinarian for so many decades. So protect yourself by using a proper gag. So this is a proper gag, and then taking off. A variety of foreign bodies are taken. We have discussed with our own vets, have taken so many varieties. What is available in the market is available as a choke. So from guava, beetroot, apple, tapioca, mango, anything is available. So what is my request is only the damage. So the earliest is best. So the duration in which it is going to be in contact, that is going to cause the damage. Subsequently it going for achalasia also sometimes. So that has to be taken care. So the duration in which it is present, if it is earlier, if I am not able to, please refer to a surgeon. If I am not able to, refer to a senior or bring the senior here, so that earlier it can be done to avoid the mucosal damage to that particular area. So this is another case. Cattle takes only water, difficulty in swallowing, and then not taking roughage around 2 months of pregnancy. Any takers maybe in the mind, calving, recently calved animal, with difficulty in swallowing. So this is because of a needle. This is cannot be diagnosed with physical methods of examination. A foreign body along the crisscross of the esophagus like this. So this is where I want to stress. There are the gadgets with the endoscope. Alone you can diagnose the esophageal problem and then take it out also. So this is able to take water, but not able to take the roughage. This recurrent bloat, we have got a lot of the differential diagnosis, and everyone has posted in the WhatsApp, and everything was interesting. And to make a recap, or to make it more interesting, we have put like this: intra and extramural lesions, amphistomes, mature amphistomes. After putting stomach, we collect a lot of it. That also accounts for it. Foreign body and the DH. So here we have got a case of recurrent bloat, and here it is able to pass the stomach the tube with difficulty. So this is what an important case other than the differentials which we have been encoding. It is a squamous cell carcinoma. Squamous cell carcinoma you would have seen other area. We have seen this squamous cell carcinoma just like cauliflower growth throughout the esophagus. So that has caused bloat. So kindly put this also into your differential diagnosis, which you are already doing it. Put this also as a potential cause of your differential diagnosis. A bull, this is from one of our animal husbandry farm, 3.5 chronic recurrent bloat. In addition to that, this is put on endoscope, we got a tumor at the LES, so which has caused recurrent bloat. So please include neoplasm, squamous cell carcinoma, and other things in your DH. DH is also an important part in the differential diagnosis, which we have been regularly doing it. I am just comparing with your ultrasound. So here you have got R is the reticulum, and this is a normal reticulum. Now please focus on the reticular abscess, a small part of ultrasound on reticulum and related structures. In reticular abscess, we get echogenic capsule, and this one. This is the reticulum. Okay, abscess is on the outside. Outside the reticulum. So that is the abscess. White color, black color. Black color, I explained already, it's a fluid. As it becomes more insipitated, then you will get a echogenic. So you more established adhesions. This will prevent the movement of the reticulum, and you will get the all sort of ileus. So this is well appreciated in ultrasound. So the physical motility or the adhesions or abscess is well appreciated, which is masked by our physical methods of examination and X-ray. Now the diaphragmatic hernia, coming on to our differential diagnostic set, kindly concentrate on this. H is heart, R is reticulum. Normally there will be one line in between that. You will not be able to see you will appreciate only heart when you are going to focus and keep the heart. You will appreciate the heart and start taking the heart measurements. But kindly focus on this one. There will be a close association of reticulum along with the movement of the heart, which normally we don't get. We see the heart that functions separately, as we have seen in pericarditis. Okay. Now you just see, please, where we should focus. You have to focus here. In the next video, kindly focus here. That is the heart, and you see this is lower part is the reticulum. So that is a clear evidence that this is a DH. So in addition to the physical methods of examination and your own auscultation, and this will be about that this is a DH. There is another case. So that is reticulum, and rumanotomy, we are taking the camera inside, and that is the part which this is a small stick that goes the hernia. That is a part of the herniation. The detail about it, I don't know whether this is there in his syllabus. Dr. Manjunath may, I don't know whether it is included. If it is there, he will be explaining more in detail about it. So coming to traumatic reticular peritonitis, reticular wall, you can see the deposits. So rumen, and this is the heart. So ultrasound is important. As you keep it, you will get what is the pathogenesis, you will immediately get. So peritoneal effusion, which you send, put a needle and see, and you can see if there is a effusion, only black color, no problem. Black color with cobweb like fibrin deposit, then it is an established case. You can tell about the prognosis, helping to pronounce the prognosis. Now other part is thoraco-reticulocentesis. This is what we have discussed. Exactly where we are putting that needle is here, on the right side. Okay. This one, those who are having a frequent case of DH, this kindly listen to this. Simultaneous auscultation of right cardiac area. Cardiac is heart. With the palpation of left paralumbar fossa for diagnosis of DH. Now this we have read during the college days, Williams method of auscultation. Stand on the left side and then the auscultation with the left hand diaphragm, right hand on the paralumbar fossa. This is how we do it, isn't it? This is Williams method of auscultation. That is to know the sequence of reticulum and the rumen. This is the method. So I am requesting you to focus how to hold stethoscope in one and feel the paralumbar fossa. This is the technique, but now you follow what we are going to discuss. So what is the criteria? Recurrent bloat or a recent carving, a distension of abdomen, unsuccessful or maybe successful in intubation, then suspended rumination. So in these type of cases, you do this technique. What is the technique I am going to do? Stand on the right side. Williams method, you are standing on the left side. You stand on the right side, okay? And the stethoscope is on your right hand. And feel the paralumbar fossa crossing over the dorsum. So stand on the right side, stethoscope on the right hand, cross over the dorsum and feel the left paralumbar fossa. Okay, so for every push here, you will also hear the sound in the diaphragm. So in those cases of DH, you will appreciate this. So those who are, and that is a case of DH, we are seeing the in ultrasound. So this we have experienced seeing this positive in many cases of DH. So those who are having a frequent cases of DH, kindly do this. Simultaneous auscultation of right cardiac area. This is cardiac means heart. And palpation of left paralumbar fossa. You will get one sound, mixing sound, which is not related to heart. Normally in thoracic area, you will get heart sound. Lap tap, lap tap, lap tap. You will get some other mixing sound. So this sound will be there with every push of left paralumbar fossa. Not ping sound. You will feel the rumen moving your left hand. So you correlate with this. You will feel before or after the motility, you will get some sound. That means there is a DH. That is, these are. Yeah, yes, exactly. Yeah, you have to listen, patiently auscultate there for some amount of time. Heartbeat will be there. Keep associated with the animal. Exclude yourself from the heartbeat and listen for it. Why? How long we have to see? For that only correlation 3 or 4 times of the cycle. So that is, because if you are going to auscultate only this, you have to wait for a long time. So we need a motility. So this case happens to be positive in our cases. I am requesting you to experience yourself. So apart from the heartbeat, when you keep on, just like meditation, when you start doing meditation, you will hear all the sounds. Now, songs, dance, shouting, everything. As you keep moving into the deep meditation, you will be excluding from the environment. Like that, exclude your heart sound or other environmental sound. Listen only to the heart sound and this one. You will get definitely. We have experienced, our students have experienced. So you will also do it. So this is we have done in Namakkal, and our student call it as a GV's technique after me. So mixing sound or peristaltic sound is heard in the DH, normal heart sounds in. So this again I re-emphasize this solid or liquid waste management, and this is nylon rope, fishing rod. This is again not only nylon rod. So this one is arnagir, waste rope. What is the beauty? Is it? This is thrown everywhere and the animal swallows. What happened along with it? This is get entangled in the epiglottis. The other part is hanging in the esophagus. Okay. The animal chews the roughage and cut goes. This gets locked in it is on the form of a ring. So other part it is there. So it cannot go. It is caught in the loop. The other loop is in the epiglottis. So animal is not able to swallow. So that is what we have. Then this is in epiglottis, other part is hanging. So we have to educate this able to after removal. This part is hanging in the epiglottis. This is in the esophagus. It cannot further swallow anything. So this is a linear foreign body in cattle. So this is all because waste management, not only biomedical waste management, throwing the needle and other things, it also has to be emphasized and taught, educate, the owner has to be educated, and all the things starts from the home, from children, grandchildren, kids, everything. Then it becomes easy. Then we try to give green earth, recyclable earth, fresh earth to our youngsters. Fishing hook. Advantage is taking biopsy also. Now this is one interesting case. The kid has swallowed the nipple. That lady sent him out, come with the nipple, otherwise don't come. He sent the kid, then we said we will offer you one nipple one. No, the same nipple my wife wanted. So interestingly, we put the endoscope and took it out, just for making the thing interesting, we told. And a similar thing on the respiratory tract. So this is epistaxis, and then previously you have seen a small pink colored normal one. Here you can see the tumors. It is easy for explaining the owner. The tumor, a big tumor, and this is posterior part. Take the endoscope through the mouth and see it 180 degree, and you see the tumor. This is not possible in antemortem, only in postmortem. So this specifically you take biopsy, and certain with the biopsy you can identify it, and it helps in choosing the drug. One day this endoscopy will be common. You just see within LAVA itself will organize one seminar exclusively for endoscope. This is another case, a buffalo, open mouth breathing, radiograph nothing, and physical methods of examination not able to diagnose anything. So it has gone down in condition. It was yielding 16 plus kg. Now you can see this is epiglottis. Just to re-emphasize, below the epiglottis is the problem. So epiglottis, this is the tumor. You cannot identify, isn't it? Unless you open the mouth wide enough, use illumination. So it is not able to have a normal respiration itself. Epiglottis is not able to close when it is able to swallow. It goes for respiration, okay, aspiration, and that comes for a pneumonia. Treating for pneumonia, they're not able to treat. So these are catchy things, gadgets helps to the bedside, and we can diagnose it. So that is the tumor taking that going for a neoplasm. And this is the trachea, and this is yet another case which you will accept. This is a tracheal tumor, animal having a chronic cough. So chronic cough always disturbs the animal from taking. So down the trachea will go, and then you are able to see this big tumor. So this is also cannot be diagnosed, this one. Keep on treating for cough. So the added, you can go for diagnosis of fungals and other things. This I am skipping. The esophageal tear, again by intubation with the stomach tube, and there is a huge tear, and all the fluids have got collected there, forming a big bag. And ultimately we have to condemn this. Request is either please be gentle for all the procedures. We have some more time, sir. Again, this is my my favorite. So the dung is important. Any person, any large animal veterinarian has to examine the dung. That's a must for any animal. So you can see this is one animal. This is from other animal, and then to correlate, this is a strawberry and this is a raspberry. So raspberry jam. If you just see it, this is the intestinal obstruction or intussusception. So the raspberry jam appearance of the dung. Either when you do a rectal examination, take a smear of the raspberry jam appearance, or the dung is passed like that. It is if you are only a clinician and not very thorough in surgery, immediately call the surgeon or transfer the case to the surgeon, okay, or to your seniors. So it needs a surgical intervention. So raspberry jam appearance is this one. This is a favorite. Many of our students will remember this because I give a jam to them in the class. Afternoon 2 o'clock class, I give a jam. I tell this is a jam because I also take in my hand and then eat. While they are about to swallow, I will tell this is a dung, raspberry jam like appearance of the dung. It is an intussusception. They will never forget in life. When they are about to swallow, they cannot take. This is a jam only. But to make it remember in the sulci, I tell this is a dung. This is how dung looks for an animal with intussusception. So your business, if you are a clinician, thorough in diagnosing the disease and treatment, you have no job, transfer the case to a surgeon. So to put into their brain, so this is a dung. So they are still doing, and I want this to keep on spreading. So the other part is this is blueberry, blackberry. When we are studying, we have not seen, but because of supermarket, hypermarket, all these are available. Okay, now these are also come for good for renal treatment, berries, jams, and everything in human. That is a blueberry, this is a blackberry, this is how your cell phone has been named after this. Blackberry dung, blackberry jam-like appearance of the dung. It is because indiscriminate use of NSAID. I will not go deep into that. There are a lot of controversies, support for and against the dung. Indiscriminate use of NSAID. Okay, I will point only one point in that. So this is, don't think this is the Chandrayaan taking our sun, our moon slide. This is the abomasum of our own cattle from one farm. Okay, so that is the abomasum, a big ulcer. You can see this one, the animal has been operated. This animal had LDA, now recently carved LDA, so treated with NSAIDs, and then developed abomasal ulcer, and see how much amount of fluid is coming out. So this is our own animal. So don't, you can use, I'm not saying don't use it, you can use it cautiously to the benefit. When your advantage outweighs the disadvantage, you can use. But use always this one, blackberry, or this one may happen to our cow. So you just use it. It's a cautioning one, that's all. It's a request. And these are the slight advanced for beta-hydroxybutyric acid. A strip either from the blood or from the milk or from the urine will help to identify the ketosis. Urine. And they please do this also. Liver biopsy. Recently carved animal, not responding to ketosis. Tried all sort of the combinations. Please use true cut biopsy needle. True cut biopsy needle, 18 gauge, 16 gauge needle. It is only use and throw, use that. Okay, so to confirm presence of fatty liver. So what is the spot? Spot, this is the right side, this is the right side, this is the paralumbar fossa, right side, 13, 12, 1. So you have to put last but 1, intercostal space. A line joining the paralumbar fossa, middle of the paralumbar fossa, straight line towards the mandible. So this is the paralumbar fossa, right side, middle of the paralumbar fossa, straight line joining the mandible. And that line where it cuts, you have to introduce the needle. Nothing will happen. Introduce the needle. Before that, surgical precaution or shaving, and then introduce a 18 gauge or 16 gauge needle. You put that's like an intramuscular injection. Take it out. If you have shaved that area, then the point of entry will be visible. Through that, you use the true cut biopsy needle. Don't use true cut biopsy needle as such into the skin. The biopsy needle will break. To facilitate the passage of the true cut biopsy needle, you are using the needle, preferably 16 gauge needle. Introduce and take it out. And how you are going to point? You are going to point towards the left elbow. I am on right, left elbow. So the point of needle is like this. Okay, introduce and take it. So very easy, because it is going to tell you whether you can treat this case or send it to otherwise slaughterhouse. So what is the purpose? Three things. If it is normal is less than 13%, 13% or 15, it will be there in recently carved animal. That is normal. So this is the case which is going to be in more than 13 to it can even be 18 also. In recently carved animal it will be there, then it will come back. Okay, if it is that, then you can treat it. This is our case. If it is going to float in all, you cannot treat the case, send it for slaughter or whatever purpose is there. So simple, putting a needle, taking a biopsy, and then take 3 pieces or same piece also you can put in that. If it floats, then it is not in our hand. The first category, it is in our hand. If you treat it for ketosis vigorously, you can combine isoflurane, glucose, insulin, and other combination what you are already doing, this will respond. Okay, sir. Thank you very much for patience. SAS doubt is about the beta-hydroxybutyrate. So there are strips, just like glucometer, we have got a beta-hydroxybutyrate meter is available that can be taken from the blood. Immediately taking a blood, it gives a reading. It will tell whether you are in clinical ketosis or subclinical ketosis. Other is a strip which is used for milk. So that will give only pink color. Permanganate color, we tell as a permanganate color. Actual color is mauve color, M-A-U-V-E. The permanganate color is, original name is mauve, M-A-U-V, but we call it as permanganate color. So that color indicates the intensity of ketosis. Other color, light color, it doesn't treat. Urine already we are using, isn't it? Dipstick. So that is the strip. All these are available, but of the three, blood and the topmost will be your beta-hydroxybutyrometer from blood is top. Cost, of course, when compared to the animal, you have to pronounce it. But the period that is cost about, when I got it is 2000, and every strip it is only costing 300. Affordable, sir.